a nice clean bed, and then I'm going to position you over on your side, and then we'll turn you back over. Is there a... I actually love the bed film, though. I know it's neurotic, but I'm going to show it again. Okay, so we don't have our linens folded appropriately here, but in a hospital they are folded exactly so you can drop them in the center of the bed and go and the center seam lines up. But we have people who aren't nurses, so they never get folded right. But I never have to wonder whether or not there's going to be enough sheet for the other side of the bed. This does happen to be a fitted sheet, but there are flat sheets as well. So I'm going to line it up like this. And did you notice I never walked around the bed? I wasn't walking around the bed back and forth because it would be inefficient to go over there and wash their arm and come back over here and then go back over there and all that kind of stuff. So nobody does that kind of stuff.
How is that again?
And even if you've ever watched the nurse at or the housekeeper.
That was Patrick.
Patrick, stop laughing.
It was not me. You know I care for you. You know I don't want you to do that.
I wouldn't. You know, if you watch them, yes, I am. If you watch them in a hotel where they have to make beds all day long, they're not waltzing back and forth either. They're getting one side of the bed done. So what she's doing here is called fan folding. We talked about this a little bit with the hydraulic lift. How you take a sheet, and if I wanted what's known as a draw sheet, so something to just for continence pad, I would put it from their waist to their knees because that's where the continence issue is. And sometimes we put something down and tuck it that way. If I intend this for Mr. James, who is continent, he doesn't have problems in this area, I just want to be able to reposition him, then I would put this as the continence pad you actually tuck in. The draw sheet as it's called. If this is my lift sheet, I want it for the areas where he is most heavy and most of his body weight, half of it is between his shoulders and his hips, so I put it up here. I'm going to use this as a lift sheet, and so I say, Mr. James, there's kind of a big lump of sheets for you to roll over there. Will you be able to roll back over towards me then? And so on, so I could be, all right, going to have you bend this leg right there. Can you reach over here for me? Great. So maybe he can do that, or maybe maybe she'd be handing me the lift sheet on that side. And then what you notice is, I know there's just lots of equipment in here. And then what you notice is, Namiko, you want to do this with me? Since you can show them how you. So we're going to take out his. So I'm looking at him. I don't really want his head right on the rail. Sorry. I don't really want his head right on the rail. You doing okay? All right. You're breathing all right? Your color looks good. Notice that what she did with those covers, she rolled them in just like that glove thing that
you don't want to be flipping. This might be the poo brown.
Well, they just might have microorganisms on it. So we're rolling things in, we're keeping them off our gown, and we put them directly into the linen hamper.
And you don't touch it.
So let's pretend like the chair is our linen hamper there. Nurses will go and just get a plastic bag and tie a knot hanging off the edge. Okay. And so she's going to pull the sheet. If it was I'm going to show you how we actually do a flat sheet.
Sometimes you have to bend the mattress.
And we want to make sure there's no wrinkles under our patients because you don't like to lie on a wrinkly bed and that increases their chances, I know, skin breakdown. And now, Mr. James, I'm going to have you lie on your back for a minute. And what people always, when you're going back and forth, tend to slide down in bed. So Namiko and I are going to use our lift sheet. And maybe he can put his hands up and he can hang on here and he can pull. All right, or maybe he can work himself up. But let's say he can't. We're going to do that body mechanics thing we did. So on a count of three, 1, 2, 3. So we're going to lift him up. All right. And you know what? You haven't been lying on your side, Mr. He's got half a gown on, half a gown off here. I guess I'll put this one back on. Mr. James, I'd like you to turn and lie on your side now, if you think you'll be able to tolerate that, because I'd like to give your back a break. And you've been lying on your back all morning, and I know I'm going to have you back on your back for lunch. So let's lift him a little bit my way. I always like just...
Can somebody bring another pillow from on top of
Actually, we'll need 2, please. Yeah, thank you. All right, so let's bring him. So 1, 2, ready to go. So I'll lift him off the side of the bed and say, you want to put your rails up? All right. Hopefully he's going to be reaching for the rails. All right, Mr. James, here you go. Super. We're going to put a pillow.
So you can use whole thing.
All right. Hey, thanks, Jason. And so I could put a pillow here, and I think Okay, so you're going to put this under there and tuck the back to give him something really firm to lie against. Yeah, Renee did this for us. And put something for his legs.
Not my fault.
And put his head up. I want to make sure his nursing call bell is there, and I could actually then change the sheet over the top of him, put a clean sheet on. And we tend to save the blankets until they are soiled. We save these a couple of days. There are less of those available in a hospital. All right. So he's clean. Hey, I didn't do his oral care, though. What's up with that?
It's every 2 hours? You
Well,
do it.
it's at least, there's a series of care. There's AM care. So what do you do when you get up in the morning?
Brush your teeth.
Brush your
wash
teeth.
I go to the bathroom, right? The first thing you do is going to go to the bathroom, so he's going to need to be toileted, wash his hands, and then he's going to probably brush his teeth before a meal, wash his face and hands. So a lot of times during the day we're offering to let people wash their hands and face. Maybe we won't get this full thing done before breakfast, all right? So we just minimally do that hands and face wash and so forth. But let's say our gentleman here needs to have us do that oral care. Is it actually happening? Is that one? It's not snapped. The bottom isn't locked up.
What was it, vacuum?
So this is a vacuum. But there's also, yeah, here you go. So there's a, here's a sheet. So I could actually use, there's one that says patient, and here's this. So I could be, I know, it says actually for patient on top of it, so it's one. Wait, this is section, I don't have the one. Do you have a toothbrush one in there? I think there is, excuse me. Yeah, there you go. Okay, so we could put a towel there. I think it does actually work, this section. Yeah? Give it, do you want to, you have to put it on full, I think? See if I'm lying. Oh, yeah. So I could put the suction, and can you show them how you check and see?
Right,
that-
fill it. Right now it's not suctioning, so you can put the mouthwash here. You break it, you stick it, right, and clean, then suction. Now it's suctioning. See, there's a hole,
And there's she's
And
got
the
her thumb on a
sponge.
valve.
right? This you control it,
Okay.
right? And then
And so notice I have him with his head up and tipped on his side where it's less likely to run back into his mouth. All right?
right, so you use this like that.
You guys need kidney basins too?
Yeah, that's funny you say that. Do you mind getting one for me? It's right over there, Renee, and I'll do that. Sorry. Because I was just thinking I should have put one down. Okay.
And it has a mouth moisturizer in it too.
So you can put something on their lips so they
Can
don't
you
get mouth
try it on
infections.
Derek and see how it works?
Tastes like mint.
Yes. Here's Jared. No.
Tastes
I don't care
So-
if you use one of these.
So I just record
Thank
it.
you. And so we could have also put this there for them to be able to facilitate this with a towel under it so we aren't making a mess. Here's an actual toothbrush which is very, very soft. This is called a toothette. It just doesn't have the suction, but you could be able to cleanse teeth in that manner. What if it would happen if I put this on the back of his tongue? All right, and then what could possibly happen if you stimulate a gag reflex?
You throw it.
People could actually vomit. All right, so this I'm using around the outside of his teeth, all right, in general, and so on, and his gum and his buccal area and stuff like that. And we don't actually put it between the teeth of someone who, without a different airway device, of a neurologically impaired person, because we don't want him to bite down on this, all right, and we can't get it back off, or it breaks off in his mouth, or he breaks a tooth. So in general, what I'm doing with this is I'm doing this around the outside of his mouth, and you'll see in special circumstances there are other things we're going to do if we need to be within his mouth. And some people can do this themselves. You can like hand it to him and say, okay, I need you to do this. You know, here's the thing. There's a mirror device in here that comes and opens up so that they could look to do their own kind of grooming.